Hello, my name is David Soler. I'm a PhD senior postdoctoral researcher in the lab of Dr. Andrew Sloan. He's a neurosurgeon at UH hospitals, and we are doing research on Glioblastoma multiforme, which is a type of brain cancer, one of the most aggressive types. It has a very bad prognosis even with aggressive treatment. Patients perish within 1 year from initial diagnosis. So we're trying to develop a new way to differentiate this malignant type of brain cancer from another relatively benign condition called radiation necrosis, which is a consequence of the treatment for this tumor. So patients that develop this brain cancer, they are treated with surgery and chemotherapy. But when the patients come back after 2 or 3 months after initial removal of this brain tumor, the neurosurgeons are faced with a problematic that they cannot tell apart this radiation necrosis from recurrent GBM, because the current technology to tell these two conditions apart is based on brain imaging, MRI, as you might be familiar with. And this technology is based on contrast enhancing techniques, and it cannot differentiate the recurrent GBM from this radiation necrosis, which has a better prognosis value. What we have found out is that this new, what we call it liquid biopsy test, because doesn't involve doesn't require a biopsy from the brain. It just can be done with a minimally invasive procedure, such as blood drawn from the arm or from another place from the patient. And with this blood drawn, we are able to measure and quantify this type of cells that then they are telling us whether the cancer is returning or it's not. And this test has been very successful. It's very sensitive. We are looking either for commercial partners that might be interested into developing this further down the clinical alley. And we are also interested in looking other types of tumors, because these two novel biomarkers are not specifically for GBM. And we will be presenting this research at this 2017 ShowCASE poster presentations. And that's the state of our research currently.